Hello, my name is Dr. Manish. I am a pain management specialist or a pain physician. So, what is pain? Today, my topic is to describe more about the details of pain, how it is felt, and how it is expressed. So, pain is an unpleasant sensory and emotional experience associated with or resembling that associated with an actual or potential tissue damage. So, what is it? It's an unpleasant experience. It's a sensory and an emotional experience. So, we feel it, we experience it. So, and there is an emotional component to it. Also, there should always be a tissue damage present, and there might be a phenomena that is causing resembling that of a tissue damage. So, I am going into the details of it. So, whatever happens with pain is that when we feel it from our peripheries, like when we are actually hurt, when we fell down, and when we fall down and actually get injured somewhere, from there are some receptors which actually receive the pain, and there is a process of transduction and transmission, that is a form of energy is converted, some mechanical, chemical, or a thermal energy. Whenever we are getting pushed somewhere, we get hit somewhere, there is a physical trauma. When there is a acid burn, there is a chemical trauma, and when there is an attachment to a warm or cold sensation, a very warm sensation, and there is a thermal phenomena. All this form of energy actually gets converted to an electrical phenomena, the electrical energy. So, there is a transduction, and that electrical energy is transmitted. So, there is transmission to the brain through various pathways. So, and that is after that reaches the area of brain, we perceive pain. That is called perception. So, another path is the perception, and there is another last point, that is the last step is the modulation, where some areas from the brain, the pathway come down to the spinal cord, which actually modulates pain. That's why one person experiences pain which is different from another person. So, of these four steps, there are many areas where there are some pathways where the medications act. Some medications like paracetamol, which acts in the area of perception in the brain. There is some medications called diclofenac. We use ibuprofen, and those acts in the transduction phase, where they modulate the chemical release from the area where it is actually started to feel, where we actually start to feel the pain. And there are some pathways like opioid receptors, and where the morphine, fentanyl, those medications act in the spinal cord level, and also at the supraspinal level near the brain. And last but not the least, the anti-neuropathic agents, that is a pregabalin, gabapentin, nortriptyline, amitriptyline, duloxetine. These medications act in the modulation pathway, and all these medications in their own manner help to regulate the pain, help to suppress the pain, so that we can lead a pain-free life from the physical part. There is a physical part of the pain that I can describe. And so, coming to the classification of pain, so it can be classified as three types. There is a nociceptive, nociplastic, and neuropathic. Nociceptive pain is like where we feel there is some receptors, where there is some areas of signaling, whenever we are dealt with pain, those receptors get activated. So, this is a nociception. Anywhere there is when we fall down, and when there is osteoarthritis in the pain in the joints, and those areas we called as a nociceptive pain. It's kind of a sharp pain, well localized pain, and mostly it is a area of pain doesn't get radiate to somewhere. It's mostly localized to a particular area of the body where we are actually got hurt, or where actually the pathology is. Second is a neuropathic pain. Neuropathic pain is a kind of somato-sensory system is involved, that is, a nervous system is involved. When a pain is radiating from one place to another, whenever there is a source of pain, it starts from there and goes to another, like a low back pain going to the legs, like a neck pain going to the hands, and it's a kind of a character, it's a burning character. It's kind of sharp pricking pain, and whenever there is a pin pricking sensation, and also associated with numbness, and some get heaviness of the hands and heaviness of the feet, and those are kind of a neuropathic pain. And there are other medications for that, and which is different from the nociceptive pain. And third is a nociplastic pain, which is example is a fibromyalgia, when there is an altered nociception. Whenever we feel pain, it is different, the signaling is different. And fibromyalgia is a condition where there is a whole body pain, and in fact it is not amenable to normal medication like paracetamol, ibuprofen, or diclofenac. So, whenever we take a history of pain, we have to know its site, its character, its radiation, its intensity according to the NRS, that is how much is the intensity of pain from 0 to 10, and also its aggravating and relieving factors. What are the features, like whenever it's getting aggravated on walking or sitting or particular posture, and all. And also we can also have an history of occupation. What is the posture of the patient all throughout the day, and what are the activities of the patient, whether she or he does the exercises or not, and what are his or her lifestyle, the diet and all. So all these things coming to the history of pain. And also we go to the examination. We examine the patient, we localize the area of the examination. There are particular tests we perform, and to understand the source of pain, and accordingly we try to manage it. So in this topic, coming to the take home message of this video is that pain is a phenomena which is a chronic phenomenon. It can be an acute or a chronic phenomena. Acute is like within 7 days after a fall down and all. Chronic pain is more than 3 months. So whenever a patient or whenever someone feels pain which is persistent for more than 3 months, they can come to a pain physician to get the pain assessed, to know the source of pain, rather than going to a pharmacy and taking some painkillers, which will not help and it might have some side effects. And second point, always whenever there is a kind of pain involved, always think there is not only a psychological phenomena, it always involves both physical and psychological, and that has to be taken into account. And from the history to examination, we try to localize the source and accordingly manage it. Hopefully you are all stay well and blessed. Thank you.